everybody, and welcome to another episode of Fun Facts at the Pharmacy. I'm your host, Dr. Christopher Greider. If this is the first time you're tuning into the show, I'm actually a pharmacist for Mark's Pharmacy located here in Northeast Ohio. The purpose of the show is to give you guys good health information and to help you make better choices in regards to health decisions, especially when you're having a hard time trying to get a hold of somebody that can provide additional help, whether it be a pharmacy that's closed or if you're unable to reach through to your physician's office. So to start off, at the beginning of every episode, we have a section called Fast Acting. It's to give you guys some information that's very quick and very recent about the current information that you may need to know. So the first thing that we have going on today is I'm talking about drug recalls. Now, from my standpoint, from where I work, I get phone calls about this almost on a daily basis. Recently, within the last couple of years, we've had a large amount of drug recalls that have occurred. Now, a lot of patients are normally concerned about this because all the news will sometimes give you is just the name of the medication. They may not give you any additional information, and they may not help guide you as to where to find more information about this. So the purpose of this is to inform you guys that drug recalls do happen on a daily basis. We always at the pharmacies get some form of letter or something from the drug manufacturers themselves or our drug distributors that tell us that there's something wrong with a particular medication, whether it be the release mechanism on it doesn't work as effectively as they were hoping to, or there sometimes happens where there's random impurities that can end up in the medication from when they had actually made it. Now, sometimes with these impurities, it can cause a little bit of a concern. So the most recent one that we've had was there have been recalls on certain blood pressure medications, especially losartan and valsartan. Now, if you look at your pill bottles and you have those listed in your ingredients, it doesn't necessarily mean we want you to throw out your medication right away. The best thing you can ever do is to contact wherever you get your medications from, whether that be a mail order service, whether that be your local pharmacy, and check with them to find out, are any of the medications they have recalled? Now, the way that we can detect this from the pharmacy standpoint is every pill bottle that we have has a manufacturer's lot number and expiration date. These are the big important things that tell us when they made these medications, these are the lots that were impacted. These were the pill bottles that had problems. So we can always go back and double check to make sure. If we ever have those products that are on our shelves and they do send us a drug recall, we actually get rid of those medications right away. It's not something that we actively continually give out or hand out to cause any further problems for anyone. Now, the main thing with these recalls is that sometimes you'll hear scary words, especially with the recent impurities recall, was cancer. Now, they keep mentioning the word cancer, cancer, cancer. It's a scary word to throw out there, but what they found was the impurities that you found within your tablets were no different than if you were to walk around in the environment and pick those up. So it's not saying we want you to necessarily take these medications, but if there's no good alternative or they're unable to do anything or you're unable to find out about it, they do recommend, according to the FDA, to continue to take your medications as is. The reason being is, with a lot of these medicines, especially your blood pressure medicines, you can be at a much higher risk of having serious conditions such as heart problems, high blood pressure that can kick in that can cause you to be essentially hospitalized, and sometimes it can potentially lead to severe conditions leading to the extreme of death. Now, it's a scary thought to think of, but it's not me trying to scare you into taking your medications at all. The point of it is to let you know that just because there is a recall, it doesn't necessarily mean that you have to throw everything out. Check with your pharmacies because we normally, especially even at Mark's, we throw out letters to all of the patients that had possibly been impacted by it to let them know. If we have any medications that are hit with it, we always send something out to inform the public that, hey, maybe your prescription could have been impacted. If that is the case and you're ever unsure, you can actually check the FDA's website where they actually have a list of every single lot number and every single expiration date that was hit by it. Check with your pharmacies as well because, like I said, they're the primary source. Your pill bottles sadly won't have that specific information on it, but if there's ever a doubt or concern, we can always talk with your doctor's office, or if you wish to talk to them directly, we can always get your medications changed to something else that may be very similar to it that will still help you out. So with that being said, the main segment we're kind of talking about today is with the nice weather outside, it's so easy to go outside and be happy and enjoy the sun, be around nature. But there are some concerns that we always have. So with me today to talk about some of those things, I have a fourth-year student from Neomed. Her name is Alicia. Hi, Alicia.
Hello.
Thank you for coming on to the show here. So if you want to, what are some things that we typically are kind of concerned about with people being outdoors?
Okay, so one of the big things that we're concerned about is sunburns. And then another big thing we're concerned about is bug bites, especially mosquito bites around this time of the year.
Yeah, and that's one of the biggest things is with insects. They're all around, so we always have to be real careful with that. But the biggest thing is the sun, because as soon as we get that nice weather to kick in, everybody's outside, everybody wants to have a good time and, run outdoors, go camping, do all these types of things. So what are some things that we should ever be worried about? Because most people always hear the good things about the sun, but there are some things we need to be cautious about. So can you tell us a little bit more about that?
Yeah, of course. So the biggest thing that we're worried about with sun exposure is going to be skin cancer. So as we know, skin cancer comes from exposure to the sun, and skin cancer is currently the leading cause of cancer in the United States. So about 5 million people are treated for skin cancer each year, and it has a mortality rate of 2.4 people per every 100,000 person. And the incidence of melanoma has actually been shown to be associated with the latitude and intensity of sun exposure. So when we're exposed to the sun, we're exposed to this UV radiation, and this is UVA and UVB. So UVB is what has been shown to be critically related with sun exposure and melanoma, but also prolonged exposure to UVA is associated as well. So UV exposure for even as little as 15 minutes can cause a sunburn, and then this adds up and then ultimately leads to an increase in your risk of skin cancer.
So we always want to be cautious about that because, like you had mentioned, there's different types of UV radiation that exist, so we always want to be careful. Sunburns is a big thing, but it can potentially lead to a lot of damage that occurs over time. So just like you mentioned, we just need to be very careful of that. So now, when we're talking about, being exposed out to the sun, is there any particular groups of people that are prone to it, or is it just anybody susceptible to it? What are your thoughts on that?
Yeah, definitely. So as far as sunburns and sun exposure, it seems that adolescents have the most exposure, and then this decreases with age, and then men usually have more exposure than women do.
Okay. And the other thing we always want to look out for are people that are typically working like outdoor jobs too, because they're at a higher risk than most other people that may be working in an office, working within a store, some other facility. So we always want to be careful. And with kids, especially adolescents, I mean, we're talking sports. So I know, especially even back in my day, like running track and things like that, you were always outside. So so we want to be careful there. Now we have a lot of people that are being exposed to the sun on a daily basis, and especially based on location too. So if you live out in California, Florida, I mean, you're getting way more exposure. Are there things that we can do to kind of help protect against it that may not require any kind of medication or anything like that?
Yeah, definitely. So there are 3 big things that you can do to avoid the sun. One is just sun avoidance in general. The other is protective clothing. And then the third, probably the most important, would be the sunscreen. So I'll go into a little bit of each one and some important factors revolving around those. Okay. So the first one with sun avoidance, it's most important between those high intensity sun hours of 10 a.m. to 4 p.m. So staying indoors if possible, if not, kind of just trying to stay in the shade. I know one thing people probably don't think about quite as much is anyone doing extreme sports and they're out, especially like rock climbing, mountain climbing, doing things that are bringing them actually closer to the sun, they're at an increased risk for this sun exposure. So the next would be protective clothing. So wearing clothing, I know it's hot, but trying to wear clothing that covers your exposed areas. So some things to think about with this would be wearing like the tighter woven clothing, because then the sun can't get through as easily. Actually, darker clothing tends to repel the sun a little bit better than the lighter clothing. Hats are a good thing to wear in the summer. So not necessarily baseball caps. Unfortunately, those leave your ears and the back of your neck exposed. But if you could find a nice hat that's brimmed all the way around, particularly not a woven one, because then again, the sun can get through. They do sell sunglasses that have UVA and UVB protection. And then also one thing a lot of people don't think about is that you're more prone to sunburns when you have a wet t-shirt on. So especially when people are out like boating, at the beach, at the pool, your shirt gets wet, you might not think about it because you do have clothes on, but the wetness actually allows the sun to get through easier.
Okay. So we just got to be real careful, especially for getting anything wet, that sort of thing. So, okay. So you had mentioned something really important that I always get a lot of questions about day in and day out from the pharmacy, which is sunscreen. So
Yes.
sunscreen is probably the number one thing that they always recommend for helping to protect against the sun. But can you tell us a little bit about what we should be looking at when we look at our sunscreen bottles and the different types that are out there?
Yeah, of course. So sunscreen, like you said, is very important because it helps reflect some of that light and avoid the sunburn. So actually in 2013, only 1 out of 10 high school students reported using sunscreen when they were outside in the sun for over an hour. So this is definitely something we can work on. And with sunscreen, there's a million products. So what should you buy? That's really the big question here. So when picking out sunscreen, you can refer to this image shown here, produced by the American Academy of Dermatology. So there's really 3 things they recommend when you're looking to pick out a sunscreen. The first is the SPF. So this stands for sun protectant factor. And this actually has to do with the percentage of the UV radiation that is being blocked. So they recommend picking out a sunscreen that has an SPF of 30 or greater. Number 2 would be that the sunscreen is water resistant for at least 40 to 80 minutes. So companies can no longer state that they are waterproof or sweat-proof, so really water resistant is what you're looking for. And then the third important thing is that the sunscreen is broad spectrum. So what this term means is that it is protecting you against both the UVA and the UVB. So some ingredients to kind of look out for. So the ones that are going to protect you from UVA would be the avobenzene, the oxybenzone, and e-camisole. The UVB protection is from the aminobenzates, also known as PABA or PABA esters, cinnamates, which is also the oxinate or sinoxate, or salicylates. And then some other ingredients you might see in there is zinc oxide and titanium oxide, and those actually just act as protective barriers for the skin. And then another thing important when you're looking at these ingredients, if you do have an allergic reaction, it's important to not just give up on sunscreen altogether, because like I stated, they all have different active ingredients, so there might be another sunscreen you could use. So maybe going to your physician and asking them what they recommend. And lastly, as shown on the image, they do recommend 1 ounce or about a shot glass full should be what would cover your exposed areas of your skin.
Perfect. So the main thing that we're looking at is if there's ever a question or a doubt, we can always check the back of the bottles or the products just to make sure that we have a little bit of everything. But as you said, the labeling has become stricter about a lot of things nowadays. So typically what you're reading now is going to be more direct about what they actually contains than what had previously been mentioned, like you had said. So perfect. So if anybody ever has doubts or questions, I mean, by all means, they can definitely come and check in with their pharmacist if they're unsure if they have the right products there. And as you had mentioned, now with the SPFs, what they always recommend is the 30. Now, to be perfectly honest, if you do go up to those higher ones, some of them will contain 70 or 80. There really isn't a difference, to be honest. As long as you're maintaining that 30, that solid 30, that's all you need. If you get less than that, it can't give you as much protection, so we always want to be careful with that. So, perfect. With that being said, the main thing is in case somebody was to get, say, sunburnt or, some form of almost like sun poisoning is how they sometimes term it when you get too much exposure to the radiation. What are some things that people can get for treatment if you are dealing with that?
Okay, so there's 3 different classes of really treatment for your sunburns. The first one would be skin protectants, and you're going to want to use any of these for about 7 days. So different examples of this is the allantoin, the cocoa butter, or the petrolatum. And then also there is the topical analgesics, which just means topical pain relief. So this would be the benzocaine, the lidocaine, or even topical diphenhydramine, also known as Benadryl. And then the third, which I think I see the most, would be the aloe gel. And that's going to help heal your burn, give you some relief most of the time, so that's a good option as well.
Yeah, and the main thing with those ones too is that we sometimes want to try and avoid oral like anti-inflammatories because sometimes they can cause a little bit more of an issue.
Yeah.
But worst case scenario, if you're dealing with excessive amounts of pain, it would be an alternative to kind of help with that inflammation that's going on as well. So
Yeah.
perfect. Now, when we talk about medications, I mean, we talk about treatments, we talk about other things, but are there any particular classes of medications or things that people should look at that might make them more likely to have sunburns or have issues with their skin?
Yeah, so that's a very important point because there's actually quite a few medications that can increase your risk of getting a sunburn. So 2 very common medications that can cause this are just ones that you buy over the counter. So naproxen, also known as Aleve, or ibuprofen, also known as Motrin. Those can increase your risk. There's also various antibiotics like doxycycline, minocycline, ciprofloxacin, levofloxacin, sulfamethoxal, which is an active ingredient found in Bactrim. And then also other classes as well, including a lot of people are on statins for their cholesterol, which include pravastatin, lovastatin, simvastatin, rosuvastatin. And then a lot of antibiotics can actually increase your risk too. Some of these would be doxycycline, minocycline, ciprofloxacin, and levofloxacin. And if you're ever unsure if you're on a medication that can increase your risk, you can always go to your pharmacist and they will have the information to give you and let you know if you are at an increased risk because of your medication.
Yeah. The main thing that I always want, and this is kind of more of like a side note to this, is that it's not us saying that you necessarily have to stop taking these medications. That's not the point of this. What we're ultimately looking for is just to make sure that people are more aware that they may require additional protection or they may want to be covered up, especially with a lot of the antibiotics, because most of the other medications are more of they can be more of a long-term thing. So you always have to be careful all the time. With your antibiotics, it's more of like while you're on those medications. So sometimes common durations are about 7 to 10 days. We want to make sure that people are still taking their medications, but just using a little extra protection to be safe on that.
Yeah,
So.
of course.
So we kind of hit a little bit about the sun stuff, and now I know you had mentioned something about treatment for bug bites, especially mosquito bites, because that's probably the most common one that everybody hears about.
Yeah.
So what can you tell us a little bit about mosquito bites and what we can get?
Okay, so there's mosquitoes, unfortunately, can carry some mosquito-borne illnesses that can be transmitted from mosquitoes to humans when they are bitten by them. So 2 of these common diseases would be the West Nile virus or the Zika virus.
Okay. So I know typically with both of those, like the West Nile was bigger, say around like the late 90s, early 2000s. And I know when we're talking about Zika, that was a big thing from a few years back where we were kind of concerned about it. So we'll kind of just take it a little bit at a time here. So we'll start off with more of like the West Nile virus. So what can you kind of tell us about the West Nile virus?
So the West Nile virus is the leading cause of mosquito-borne illnesses in the continental United States. So as of January 2019, there was a total of 49 states and the District of Columbia that reported having the active virus. There's been over 2,500 cases of West Nile that were reported to the CDC, and that's just reported. Of these, 63% were very serious, and they were neuroinvasive diseases, which I'll get more into that. And only 37% that were reported were the non-neuroinvasive.
Okay. So when you're talking about the neuroinvasive, what are we kind of talking about there?
So the neuroinvasive encompasses encephalitis, which is inflammation of the brain, or even meningitis, which is inflammation of the membranes that are around the brain and the spinal cord. So these are going to be your really severe cases. They are not nearly as common, but they can be life-threatening. So some things to look out for with that would be high fever, headache, neck stiffness is a big one since it's affecting the brain and everything that surrounds it. Disorientation, a little bit of movement disorders, muscle weakness, and it could even lead to paralysis if it was severe enough.
So we got to be real careful on that one.
Yes,
If anything.
definitely.
So with that being said, we'll kind of jump in a little bit with the Zika virus because in regards to treatment and preventions, that sort of thing, they kind of encompass both on the same kind of category. So what can you tell us a little bit about the Zika? Because I know that was more recent of a concern.
Okay. Yeah, so there's actually no local transmission of the Zika virus currently, which is great. But in 2016, 2017, it was more prevalent, and it was mostly in Florida and Texas. So this one also from a bite of a mosquito. But what you're really worried about with the Zika virus is pregnant women. So it generally will affect the fetus or the unborn child more than the pregnant woman herself. So if a pregnant woman is bitten, it can get transferred to the unborn baby and cause some serious like brain defects when the baby is born.
Okay. So we always want to be safe, especially with pregnant women when we're talking
Yes.
about this type of thing. So, okay. So when we're talking about prevention, that's the biggest thing, because to be honest, with treatment, it's a little bit different than most other disease states, so to speak. What are some things that people can do to prevent themselves from being bitten?
Okay. There are no vaccines for these illnesses, so you really want to be active with bug spray. That's your main thing. So some things that we can do to avoid getting bitten by these mosquitoes, one big thing is clothing. So making sure you're wearing long sleeves, long pants, anything to cover the exposed areas, really. If you are outside and you are in a place that has a lot of mosquitoes, they do actually sell hats that have netting that can protect your face. And they also sell permethrin that you can pre-treat your clothing with.
Okay.
And also there are just some simple things you can do at home. So staying inside when the mosquitoes are out obviously would be great, but I know that's not always feasible. So with this, when you're inside, I know a lot of people, they recommend having air conditioning. But if you don't have air conditioning and you have, say, your front doors open or your windows open, just making sure that you have screens on those so that the mosquitoes can't come in that way, making sure there's no big holes in the screens. As far as having your babies out, you might want to have them out in a stroller. They do actually sell protective netting that you can put over their carrier or stroller, so that's always important to help protect your babies. And if you are outside and you can't have the air conditioning or the screens, they do sell bed netting as well that you can put over your bed, so that way you are protected. And then lastly, just avoiding sources of water, because this is actually where the mosquitoes are going to lay their eggs. So some places you wouldn't think about, but like your tires, they collect water, any buckets or barrels as well, anything that's going to have the water, just trying to avoid that as much as possible.
Perfect. And one of the things that I actually had come across, and there's been studies about it, is that they are always trying to find out, are there any specific disease states or anything else that could be related to it with bug bites. Now with mosquitoes, it's a little bit different, because ultimately it's not necessarily that they're trying to suck the blood out of our system, but they're ultimately just getting the sugar out of it, which is interesting. But what they have found is that actually, if you are the person that ends up with 18 bug bites, like myself, that happens all the time, they actually have found that there is some genetic related material that actually attracts mosquitoes to you as well. So it's one of those things that the prevention is there to kind of help you out. But if you feel like you're the person that always gets stabbed, by all means, use all of these as a means to keep yourself protected at the best of your ability. So now that we kind of hit on that, the main thing that I kind of want to look at is, so if somebody was to say end up with any of these major conditions, so if they ended up thinking they had West Nile, if they are a pregnant woman and they think they have Zika, what are things that they could possibly do to kind of help treat that?
So unfortunately, there's no real good medication to treat these, so it's all supportive care. So this would be any medications for pain, anything to reduce the fever if you have one. Tylenol is good for pain and fever. Staying hydrated, but if by any means you start to have more of those severe symptoms I was talking about, I would definitely recommend seeking medical attention, whether it's even just calling your doctor or maybe going into the emergency room or urgent care, just making sure you're safe.
Yeah. And that's the biggest thing that I always like to say, is that the faster you react to something, the better it turns out. But the nice thing is with these viruses, it is something that unless you're dealing with somebody that's extremely, immune compromised, as they term it, so if you're dealing with severe cases of cancer, AIDS, HIV, those people may be more prone to having issues, but for anyone else, your body will actually just naturally get rid of it, which is nice. So it just takes some time. Now, the main thing is with, I know with like the Zika virus, one of the biggest issues was with pregnant women. Are men prone to carrying it with something like that? So
the men can carry it, and one of the problems with this is that it can be transmitted sexually. So say a man is with a woman and she is pregnant, then it can be transferred to the woman and then to the unborn baby. So it's really important that if a male thinks he has it, or even a woman, just that they are either abstaining from sex or using condoms.
Perfect. So always be safe. That's the biggest thing. So with that being said, we've kind of reached the end of this episode today. Thank you so much for all of your help today, Alicia.
Yes.
So if you ever have questions, if you ever have concerns, especially in any of the topics that we had mentioned today, please talk to your healthcare providers. There are physicians, pharmacists, nurses, everyone that's out there trying to do the best that they can to help you. So please ask for their guidance in case you're unsure. But as always, thank you so much for tuning in. Please enjoy the weather outside. We're not trying to scare you from staying outside, but by all means, just be safe when you're out there. And thank you, and we'll see you next time.